Healthy choices, helping you live healthier. Sponsored by Intermountain Health.
Welcome back, everyone. We are in the middle of May, and it is National Nurses Month. We are celebrating with nurses from Intermountain Health's Primary Children's Hospital. We have Angie, the Chief Nursing Officer at Primaries, and Kaylee, a nurse who works in surgery, pain, and wound care, both joining me in the sponsored segment. Happy National Nurses Month.
Thank you.
Angie, let's start with you. Why is it important and the significance of recognizing nurses?
Well, nurses are amazing. They're at the bedside each and every day, and they have the opportunity to make a big difference in the way that we provide care, whether it be patient outcomes or patient and family experience. The Gallup poll was recently released, and for 21 years in a row, the nurses were recognized as the most trustworthy profession. So once again, even through the COVID, all through the pandemic, our patients and our families look to us for that expert care that they need.
Thank you so much for your service,
Yeah.
because I think nurses are the ones who do the bulk of the work. I have to say, as a patient, I'm dealing, and the patients are dealing with nurses more often than the doctors.
Right, and we really want those nurses to be able to choose where their passion is. And so at Intermountain Healthcare, we have over 16,000 nurses, 1,800 at Primary Children's Hospital. So lots of opportunities for our nurses to be able to choose what is their passion and where do they want to work. Is it in the ICU? Is it a med-surg unit, labor and delivery, or maybe it's outside of the acute care hospital setting in telehealth or home care? So every opportunity for nurses to be able to really make a meaningful difference.
Such a diverse team when you're talking about over 16,000 nurses, over many other specialties, but you must be so proud.
So proud of our nurses. Each and every day they come and give 110% to make sure that their patients and families are taken care of.
Kaylee, I want to bring you in. You had such an incredible role in what all of us deal with, our pain scale. Tell us your involvement from the 1 to 10. All the time, doctors and nurses say, what is your pain level?
Yeah.
And we have to credit you for a lot of that work.
Well, the tool was created back in 2017, and it was never validated. So I was able to be part of the team that validated the tool and made it so that we can continue to use the tool and use it not only in pediatrics but also in adults. And the tool combines several different types of pain assessment. So 1 to 10, faces, the little short word descriptions you can see on the screen, and just provides a way for kiddos and adults of different learning abilities to tell us about their pain. And we have the tool in both English and Spanish. You can see that.
Well, it's such a universal tool, and Angie, having this so quickly allows you to know what kind of care to assess and to also give your patients.
Right, and the worst thing that a parent could have was a child in pain. And so this really helps us identify what level is their pain so that we can treat that pain appropriately. And really, it's nurses like Kaylee at the bedside that are making the big difference. And so at Intermountain, we really support nursing research and evidence-based practice for our bedside nurses so they can make a difference in the patients that they care for.
I think even at home, we can use it. What's your pain level? And then assess and deal with, do we take you to the hospital? Do we take you to the clinic? Let's talk about how we can support our nurses at home and people in the community.
Well, everybody knows a nurse. Everybody loves a nurse. And so it's really about thanking them for what they do each and every day, whether it be at the hospital setting, at their job, at work. But our nurses do a lot in the community as well to support all of our community members, including our children.
Kaylee, what would you love? Someone to just come up to you and say thank you for all your work.
That would be awesome. I'm not really one to love a lot of attention, but I do think the people that I work with are incredible, and I love what I do. I love working for an organization that supports us to try to make a difference every day.
That culture at Intermountain Health of supporting and embracing all of you. Thank you for everything that you do. Nurses are a backbone of our healthcare system, so thank you so much. For more information, you can always go to intermountainhealth.org, and thank you to Intermountain Health for this sponsored interview. Thank you, ladies.
Thank you.